let's start with this. So the Affordable Care Act is the law, and there are a couple of things that will happen under the Affordable Care Act in the next couple of years. The good news is that it has already helped a lot of families and businesses in the country by covering preventive care, by doing away with the donut hole for prescription drug coverage, and for making sure that children with pre-existing conditions can't be denied health insurance. So there are some very good things that have happened with the Affordable Care Act. The federal government has said to states that if we expand Medicaid coverage according to the guidelines under the Affordable Care Act, they will pay 100% of that for the first 3 years that they expand the coverage, and 90% of it for about the next 7 years. What the New Hampshire Fiscal Policy Institute tells us is that that means 36,000 people in the state of New Hampshire who earn $15,000 or less will have access to health insurance if we accept the Medicaid coverage. The other thing we know is that if we don't accept the Medicaid coverage, we will lose money from the federal government, because right now the federal government reimburses us and our providers for some of the care they give to the uninsured. And that money will go away. So if we don't accept the Medicaid coverage, we will not only have people who are uninsured, we will have less federal money than we currently do now to help our hospitals pay for the care that they're going to give to people who don't have insurance, because we also know that when people show up at our emergency rooms in need of urgent care, we provide the care, which is the right thing to do. Healthcare is necessary for our economic security, and it's necessary for personal security. So I think it makes sense for the next governor to look very closely at accepting the money from the federal government to expand Medicaid coverage, because I think it will provide more reimbursement to our hospitals for care for people who need it. But at the same time, we have to make sure that in New Hampshire, we are using that money in a way that makes sense for our state, and we also have to make sure that we are stabilizing and then lowering the underlying healthcare costs that drive all of this spending up. I don't know how many of you know this, but New Hampshire has about the fourth most expensive healthcare in the country. When you just look at a market basket of healthcare services, and we have to understand better. I took steps to do that in 2010 and will continue to do that. We have to understand better what's driving our healthcare costs so high. Because no matter who pays for it, whether it's a federal government reimbursing us for Medicaid services at 100%, or whether it's in the state budget, where we're paying for state employees' health care, or at least a portion of it, if you have very expensive underlying care, it is a budget buster. So aside from what kind of coverage we do or don't have, or how much of the federal reimbursement we accept, we are going to have to work on health care costs and how to make our system in New Hampshire more affordable and have better outcomes for the people of the state. Again, at the end of the day, this is about economic impact.